Dane is the last county in the state to remove the mandate. Health officials say vaccine numbers like this have made them feel more comfortable removing restrictions. Almost 60% of the county is fully vaccinated. Hospitalization rates have also remained pretty stable.
Now, with the public health order expired, can we say the pandemic is over?
That's a question a lot of people are asking this morning. As counties and countries continue to deal with cases surging and limited vaccinations. Here to answer some questions this morning about all this is UW Health's Dr. Matt Anderson. Good morning, doctor. We want to start by asking, so with this mask mandate being lifted here in Dane County, what does it mean to you?
You know, I think it's a great testament to the effectiveness of the vaccines and the great vaccination rates we've had in Dane County. So it's really an encouragement that we've made it this far and we have a large number of people who are protected. So I don't think we have complete elimination of risk, obviously, especially for those who are unvaccinated, but it's a really nice step.
Dr. Anderson, of course, some companies, some businesses will continue to require masks in their places. Do you think hospitals will ever lift that, or do you think that we will always wear a mask when we enter a clinic or a hospital setting?
Lots of questions about what our future looks like, and certainly I think health systems are talking about that. I do think that, you know, for the short term, for sure, we're going to be continuing to have masking, and that's really about protecting patients who are around us and others. You know, whether it's always, I would hesitate to say that, but I think we'll know more in the coming months.
All right, let's talk about kids. Summer breaks here for a lot of families. If you've got little kids who aren't eligible to get vaccinated right now, how should they feel about taking a road trip or sending their kids to summer camps?
Yeah, I think every family probably has an individual risk for their child or their children that they want to take into account. So, for example, some kids with asthma may be a little bit higher risk. You may want to take some extra precautions. I think outdoor activities are the safest for our kids. But when you look at that and have, again, those individual family discussions about what their risk tolerance is and what the status of their kids from a mental health and other standpoint is, I think parents will make those decisions and know their kids best, and certainly can talk to their providers if they have questions.
Dr. Anderson, I'm curious, would you feel comfortable traveling with your kids? Would you have them wear a mask this summer? What are you thinking for your family?
Yeah, I think our kids, you know, who aren't eligible to be vaccinated or aren't vaccinated, you know, are recommended to wear masks in those public spaces. I think that's appropriate both for their protection, but also for the protection of those around them if they could be an asymptomatic carrier. I think a road trip is really different depending upon what you do. You can take a road trip that is fairly distanced and safe for those who are unvaccinated. You can take a road trip that's not. So I think a lot of it depends on the details, and certainly wouldn't necessarily discourage it. But I think just being thoughtful about what you're doing, what the risks are, and what the risks the people who you're with are exposing around you could be.
Real quick, we've got less than 30 seconds left. Should kids under the age of 12 be flying this summer?
I think, again, individual decisions based upon case counts and, you know, underlying health risks and family risk tolerance. So I think those will be individual decisions.
All right, Dr. Anderson, thanks for waking up with us this morning, taking the time to answer our questions.
All right,
yeah, thank you.
Yeah.